Good to go? Well, good morning, Queensland. In great news, we have 0 new cases in Queensland. We have 5 active cases and we've had 9,327 tests in the last 24 hours and 8,765 vaccinations in our Queensland health clinics. We're now at 85.57% first doses and 74.93% second doses. So we're over the 85% mark for our first and we are so close to 75% for our second. So we are absolutely on track to hit that 80% double dose. And of course, as we get closer to that 90% first dose, then we know we will hit that 90% second dose. So that is really great news, but we do need people to keep coming out and getting vaccinated. And I just want to let people know that there's a number of schools that will still have vaccination pop-ups happening over the weekend. So please look up on the Queensland COVID website where those school vaccination clinics are in your local area. Of course, our pop-up and our outreach is very much focused on those areas where we need to lift up our vaccination numbers. But particularly for people on the Gold Coast, I want everyone to be aware that the Pacific Fair Shopping Centre will have a pop-up clinic there on Saturday and Sunday this weekend. So if you're out doing your Christmas shopping, don't leave it to the last minute. If you're out preparing for Christmas this weekend, pop in and get your vaccination. And also the Carrara markets will have a pop-up vaccination on Saturday and Sunday as well, along with Australia Zoo and other tourism spots. So please come out, get vaccinated. There are many options, different vaccines available now. We want people to keep helping us drive towards that have to quarantine at that point. And we only need to look at what's happening interstate, where we are still seeing over the last 7 days 9,526 cases in New South Wales and Victoria, and sadly 52 deaths in the last 7 days. So the virus is still very much spreading across those jurisdictions, and it will be people coming from those jurisdictions who will be allowed to come here without quarantining by air and road very, very soon. So please come out and get vaccinated as soon as possible.
Thank you, Minister. And as you've heard, it's a good news day today with 0 new cases in Queensland. It's actually been a week of good things. We've hit 7 million doses for vaccine. We've had 12,000 First Nations vaccinations, which is the highest number in a week. We've hit the 85% first dose mark, which is brilliant, and we're almost about to hit the 75%. We will hit that today. I think the other part of good news is that we've reached 14 days without cases being infectious in the community in both Gold Coast and Goondiwindi. So we've closed those off, and that's brilliant. And we've had no cases in Dormitory, despite the concerns about Robinson River. The other bit of good news, and it's probably something to remind everybody about, the importance of getting vaccinated. We've got 3 different vaccines available, we've got supplies and we've got access. The importance of vaccine can only be emphasised further by some information I'll share with you from the HPPC, who continue to monitor vaccine effectiveness. The latest data that they're able to share with us is that people with 2 doses of a vaccine, whether AstraZeneca or Pfizer, is there's a reduction in mortality between 90 and 92%. That's enormous. There's a reduction in admission to intensive care or hospital of between 86 and 87%. Again, that's enormous. And there's also a reduction in transmission between 80% and 93%. Again, those are enormous improvements to individuals and our community by simply getting vaccinated. So just ask again all Queenslanders, if you haven't been vaccinated yet, please come forward, get your second dose, get your first dose if you haven't done that yet either. Thank you.
Minister, just to clear something up, if I go on holidays to New South Wales as a Queensland resident, contract COVID, I get my test and I test positive, what do I do? Am I allowed to be hospitalised here back in Queensland, or have I got to stay in New South Wales?
Well, if you're positive, you should be following the rules that apply to that jurisdiction. So all of us have our public health directives that say when someone tests positive, they have to follow that public health directive in that state, and that's what people should be doing.
So I wouldn't be allowed to come back here to be hospitalised, I'd have to stay?
Look, generally we don't allow people to travel who are positive. We have allowed people who are in quarantine to move back into their own state if they reside elsewhere. But if you're a positive case, you do have to follow the public health directions that apply in that jurisdiction.
Minister, on the PCR testing, the Premier said on Wednesday, and I quote, "I'm not the Health Minister. I don't pick up the phone to the Federal Health Minister. I'm happy to pick up the phone to Scott Morrison. I have a Health Minister that can deal with the Federal Health Minister." Are you thrown under the bus by the Premier?
Not at all. No, I am the Health Minister. She was just making a fact. I have no concerns whatsoever with that statement. But the situation is the PCR test has been resolved by the state, by the federal government. Our focus is on getting people vaccinated. That's what our conversation should be about, and that's what we're getting on and doing.
When was the last time you spoke to Greg Hunt on the phone?
The last time I spoke to Greg Hunt would probably have been about 3 or 4 weeks ago when the Health Ministers spoke.
Did you not think it was appropriate, given that roadmap and that confusion, to pick up the phone and give him a call to clarify those issues?
Well, if we recall, it was Scott Morrison who came out swinging and didn't try to clarify, just criticised, and so did Josh Frydenberg and a number of other members of the federal parliament. So, you know, I think if you're going to criticise not picking up the phone and talking to someone, unfortunately, the first involvement from the Health Minister was him advising the media he had sent me a letter before I even saw that letter. So, look, we're moving on. The issue's resolved. Let's get people vaccinated so we can open up our borders.
Minister, there was a woman in hotel quarantine who gave birth to a premature baby. Why was she taken straight back to the hotel?
She wasn't taken straight back. It was a number of days. There was consultation with the mother as to whether she wanted to return to hotel quarantine or stay in the COVID ward that she was situated, and this was a collective decision made with the health service.
So just clarifying, so she chose to go back to hotel quarantine?
I believe that was her decision because it was a more comfortable environment than in the ward.
Minister, the Premier yesterday said that more can be done on ambulance ramping. Why aren't you doing more to address that issue?
We are investing over $263 million to open up over 400 beds. We're already seen in the last quarter that we have seen a 30% improvement, and we continue to see that trending in a positive way. So we'll continue to work to do everything we can to work with the hospitals.
Is that going to be good enough though when half of all patients are being ramped at Logan Hospital at the moment?
Well, we have said there is a lot of work that is being done and continues to be done, and we will work with all of the health workers and with the paramedics as well. But I have said just about every time I've spoken about the pressures on our hospital system that if we want to reduce ramping, we have to increase bed capacity. And there are different things to do there. We are doing what we can to open up bed capacity, but there are also other things that can be done, which I've talked about, which is a Commonwealth responsibility around aged care and disability. That's just a fact. That's 600 beds. That is a fact.
But how can you have an inquiry into the health system and not look at ramping? That seems an incredible...
Because we are looking at ramping.
But not in your inquiry. It's not within the scope.
Because we're working on stakeholders on that already.
But surely for an inquiry that's going to examine the issues, ramping is fundamental.
It absolutely is important to look at the public health system, but we're already doing that work. We are already working with stakeholders, external stakeholders, with the unions, with the HHSs about our public health system. But we need to also shine a light on what's happening in the primary and allied healthcare system, because quite honestly, the Commonwealth are putting their head in the sand and saying there's not a problem, and it's just not true.
Minister, there's been some, one of Australia's top forensic scientists has raised serious concerns about the Queensland Forensics Laboratory, particularly in relation to the Shandy Blackburn case, but potentially other cases. Do you think there needs to be an inquiry into the way this lab is conducting its investigations?
Well, the comments made relate to a particular case. There hasn't been any evidence brought forward about any failings in relation to the forensic unit other than the allegations specifically in relation to this case. On this matter, there's been a complete coronial inquest in which the coroner did not make any findings about any failings with the forensic unit. And if there is anyone out there that has additional information that wasn't considered at the time, then there's avenues they can pursue to have that considered.
This would seem to be additional information, the fact that...
Then there's avenues that they can follow with the coroner.
And what would you say to the family of the woman, Shandy Blackburn, who are pushing for an inquiry into this?
There's been a full coronial inquest on this. I appreciate that not everyone is satisfied with findings from coronial inquest, but there has been a coronial inquest in which there's findings that have been made.
Have there been concerns raised about the forensic laboratory in the past?
Not that I'm aware of.
There's a case of a 3-year-old in New Zealand who's separated from her family here. Family can't afford hotel quarantine to bring her back. Surely at this stage of the pandemic there should be considerations to allowing home quarantine for cases like this.
Well, we do. Our exemption teams do consider whether there's exceptional circumstances, whether home quarantine is available and suitable in those circumstances. They are looked at on an exceptional basis already.
Minister, just moving forward to obviously when the unvaccinated or when the vaccinated can do what they can do, are you confident in the system we have, and you're confident that the people that aren't vaccinated will not try and cheat the system? Is the app prepared for that?
You know, human nature, there'll be some people who, won't want to comply. We've seen that throughout the pandemic. But what I do know is that Queenslanders have stepped up every single day. They've done everything we have asked of them. The evidence is clear. We have 5 active cases and no community transmission happening today. That is absolutely extraordinary. That is world leading, and that is because Queenslanders have come out and done the right thing. So I have all confidence that Queenslanders will continue to do the right thing, and it is Queenslanders who are coming out and continuing to get vaccinated, driving up our vaccination rates closer to that 90% and beyond, that will help keep everyone safe. And we've just heard from Dr. Peter Aitken why it's so important to get vaccinated, because they're extraordinary numbers to know that it reduces transmission by 80 to 90%. It's not just about you. It's not just about whether you think you are going to get sick. You may be very healthy, you may be young, and I'm particularly talking to our 20 to 39-year-olds, which we need to lift those numbers of vaccination rates. That it's not just about whether you think you're going to get sick or end up in hospital. It's also about your young siblings who aren't eligible to get vaccinated. It's about your friends or family who might be immune compromised or are elderly who are at risk. You know, knowing that you can reduce that transmission puts it in your hands whether you can keep them safe or not.
Minister, some other states like South Australia, Tasmania are letting their residents leave 72 hours up to a week and not have to return a negative PCR test upon arrival. Is Queensland looking at anything similar to allow residents to do short-term trips without having to test?
At this point, we have our plan in place. The plan is that at 80% double dose, we will open the borders to anyone travelling from anywhere else in Australia into Queensland, as long as you are fully vaccinated and as long as you have that PCR test. It is so important that people still get that negative test before they come in, because I've just told you how many cases have still appeared in New South Wales and Victoria just over the last 7 days, and there's still people still losing their lives from this virus in those jurisdictions. So we can't just open it up to floodgates and say everyone come in without any tests whatsoever all at once, because please remember, at the 80% mark, 20% of our population is unvaccinated. And that isn't even including the children who aren't eligible, or the children who are 12 to 16 who haven't had as long to get vaccinated. So we owe it to those kids who can't get vaccinated or haven't had the opportunity to get fully vaccinated yet. We owe it to them to still make sure that this virus comes in a sensible and responsible way as much as we possibly can.
Sorry?
Police are saying they're not checking all the domestic arrivals coming in these days.
We always said we weren't going to be checking every single person getting off those planes. It's not feasible. As the flights increase, then we know more and more people are going to come in. But I can say for today, we have 4,681 people in home quarantine who have come in since the 70% double dose. So that's fantastic. A lot of people have chosen to not wait, to come and to home quarantine, and they're doing the right thing. Now, we heard of one yesterday. One person decided to breach. They got fined and they've been put into hotel quarantine. That's what we said will happen. And I'm pleased that the system's working. So we will check our border pass system. We will check what people are uploading. We will do random checks at the airport. We will also check people at home. So there's 3 mechanisms we've got to check people's compliance. And so far, what I'm hearing is we have a very, very high rate of compliance. And I thank everyone for that.
Why then, I suppose, if we're not checking all the people that are coming by plane, wasn't the home quarantine extended to some of these road, people needing to come by road?
Because we still need to make sure that people can get from the airport, wherever they're flying in, to their home without needing to stop. Because if they are going a further distance and they have to stop for petrol and for food, may even have to stay overnight somewhere before they get to their home, it increases the risk. And it's not a risk we can take at 70%.
Would you reconsider including ramping in your health inquiry?
Sorry?
Would you reconsider including
We're already doing work on ramping right now.
But would you reconsider putting
No, we're not reconsidering the current terms, because we are already doing the work on what's happening in the public health system right now with the stakeholders.
You must accept it's insufficient, the current situation.
Because we're doing the work now. I'm not going to wait 6 months for a parliamentary inquiry to tell me what needs to happen in the public health system. We're doing that now. What I want to be able to do is enhance the work we're doing in the public health system by getting a better look at the demand or the push factors that are happening in the private sector that are putting pressure on our hospitals. So I can present that to the Commonwealth and they can be clear on exactly what we can be doing together to help where we have market failure in our communities. And that's not just in the regions, it's out of metropolitan areas where people struggle to get in and see a GP, where they can't see a private specialist, where they can't get allied health care, and they end up in the public health system. That's a pretty major factor in the demand on the public health system, and that in itself is a major job that they won't be able to do if we add in the public health system at the same time. So I want them to do this important work. I'll get on doing the work on the public health system, which we've already started and we're already seeing improvements.
The tourism minister apologised for the PCR testing drama yesterday. Would you like to take this opportunity to apologise as the health minister?
Sure. Yeah, I'm happy to apologise. There was a lot of confusion around this. We've made it clear there isn't a cost without needing a certificate. We don't require the certificate. A text, which we have always said, a text is suitable. It's been on our border pass system since it went live at 70%. That I am just pleased that people do not have to incur this cost. They can get the PCR test, which is absolutely invaluable in stopping this virus coming into our state.
Minister, the Brisbane International Tennis event's been cancelled for next year because of ongoing uncertainty around the pandemic. Is this an example of Queensland being left behind while the rest of the nation and the world opens up?
Not at all. We are actually more open than many states in this country. So we have been able to keep our lockdowns and our restrictions to some of the lowest in Australia because of the way we've managed this virus. So I think, if anything, we should be congratulated by the work we have done in managing. So we haven't had thousands, and can I be clear, it's been over 170,000 people have been positive with COVID since the 16th of June outbreak in New South Wales. Over 170,000 people, and yet we have stopped that coming into Queensland and spreading throughout our community. That's pretty amazing. And let's not drop the ball now. Let's not suddenly go, all that good work is wasted. Let's let it in before we protect our community. Let's get these vaccination rates up. Let's make sure we do this safely, responsibly, and manage this virus in a way that it's not going to overwhelm our health system and it's going to keep our community as safe as we possibly can.
You're talking about not dropping the ball. Surely people should expect that you communicate with the Federal Health Minister more often than 3 or 4 times.
I think we need to move on. I mean, this has been answered so many times over the last few days.
But we've
and
distress, Minister.
Well, it was the media asking us why people are paying $150, and there was no examples being given to us of someone who paid $150.
We weren't getting a straight answer.
Can I be clear? We have answered this. We have answered this every day for the last few days. I've just given you an apology. We have provided clarity. The Commonwealth provided clarity. Now let's get people vaccinated.
Why didn't you clarify it sooner, Minister?
It was clarified at the
5
point.
days after this. You were at a press conference with the acting chief health officer, and there was still confusion last Friday.
That's right, there's confusion. We've admitted there was confusion. We have clarified that and we have apologised. I don't know what else we can do other than get on with the job of keeping the community safe by getting people vaccinated.
When are you expecting to in the state of some of this confusion, actually publish the health directions that will matter in all of this?
So we've given an indication to businesses. In fact, we've given a commitment to businesses. First, this week, we've given them what they have sought, which is confirmation that we will bring in the mandatory vaccination rules for businesses on the 17th of December and not sooner, so they can work to that fixed date. We have given a commitment that we will provide the directions and we will publicly release the directions at least a week before then, but I'm hoping much sooner than that. So we're consulting across agencies right now on the draft direction, and I hope that we can get that out to businesses as soon as possible.
Last question.
Just for the acting chief health officer, if we could. Were you aware of the requirements for PCR testing, and were you advising the government on that, or was there confusion within Queensland Health as well?
No, look, PCR testing is the standard. It's much more accurate than RAT testing. It's the same application, PCR testing within 72 hours for people coming into Australia, and it's the same use, PCR testing, for people coming into multiple other states.
So you were aware that people could show a text message and get a free test, you just stated last week?
People can, the text message about a test has always been there, and there's always been the availability through the state clinics that are co-funded for people to get a test.
Did you advise the government of that?
Look, I think we've gone through this, as the Minister has said. Everyone's been aware. We've told yourselves and the community, and RAT testing is available, and the Commonwealth has clarified any concerns or confusion from their end.
Thanks, guys. Thank you.
Thank you.